Hello friends, welcome all of you on my YouTube channel here on Nursing File. Today in this video we are going to learn about the Hemothorax Nursing Care Plan. This is very important care plan and useful for you for the examination work purpose or for the assignment work purpose. And for more nursing care plans, case study, lesson plans, I'll talk. Subscribe my YouTube channel on Nursing File and like the video. तो ये देखते हैं Hemothorax Nursing Care Plan. नर्सिंग केयर प्लान को लर्न करने से पहले पर यहाँ पर हीमोथोरैक्स का एक शॉर्ट इंट्रोडक्शन देखते हैं. व्हाट इज हीमोथोरैक्स? हियर हीमोथोरैक्स इज ए collection of blood in space between the chest wall and the lungs. The pleural cavity means हीमोथोरैक्स में के अंदर चेस्ट वॉल और लंग्स के बीच में प्लूरल कैविटी में कलेक्शन ऑफ द ब्लड मीन्स ब्लड का जमाव होता है, ब्लड का इकट्ठा होना हीमोथोरैक्स कहलाता है, जैसे कि आप यहाँ पर डायग्राम में देख रहे हो. नेक्स्ट डिफाइनिंग कैरेक्टरिस्टिक्स मीन्स sign and symptoms of hemothorax. Here the most common symptom of hemothorax include pain or feeling of heaviness in chest, feeling anxious or nervousness, dyspnea or having trouble breathing quickly, abnormal fast heart rate, skin turning pale, high fever of over 100 degree Fahrenheit or 38 degree centigrade. Next देखते हैं first diagnosis here hyperthermia. Now here the nursing care plan format we use here. The nursing process is step nursing assessment, diagnosis, goal intervention, rational and evaluation. First sorry, nursing assessment में subjective data. Patient is saying that he is feeling warm. Objective data says vital sign high fever over 100 degree Fahrenheit or 38 degree centigrade, chills plus skin warm to touch. नर्सिंग डायग्नोसिस होगा हाइपरथर्मिया रिलेटेड टू हीमोथोरैक्स, गोल टू मेंटेन नॉर्मल बॉडी टेम्परेचर. एंड नर्सिंग इंटरवेंशंस एंड रेशनल देखते हैं. फर्स्ट मॉनिटर द पेशेंट्स टेम्परेचर डिग्री एंड पैटर्न नोट चिल्स. रेशनल होगा हाइपरथर्मिया सो एंड एक्यूट इन्फेक्शियस डिजीज प्रोसेस एंड पैटर्न सजेस्ट द डायग्नोसिस ऑफ फीवर. नेक्स्ट मेंटेन रूम एंड एनवायरमेंटल temperature. Room temperature, number of blanket to be changed to maintain near normal temperature. Third, provide tepid dispense bath. Here may help reduce fever. Next, to increase oral fluid intake to prevent dehydration. Next, provide comfortable position and elevate head end of bed to provide relaxation and facilitate breathing. Number 6, give antibiotic stress drugs as prescribed here. Antipyretics help to reduce fever. After providing these interventions, we rated the nursing evaluation steps here. नर्सिंग इवेल्यूशन होगा नाउ नॉर्मल बॉडी टेम्परेचर मेंटेन, जो हमारा गोल था हमने अचीव किया थ्रू दीज इंटरवेंशंस. नेक्स्ट देखते हैं केयर प्लान सेकेंड. Here care plan second for hemothorax, ineffective breathing pattern, nursing assessment. Subjective data, the patient reports shortness of breath and chest pain. Objective data, dyspnea, tachypnea, cyanosis, abnormal ABCs. Nursing diagnosis होगा ineffective breathing pattern may be related to blood collection in the pleural cavity. गोल होगा to maintain effective breathing pattern. Nursing intervention rational देखते हैं. फर्स्ट डिटरमाइन etiology and precipitating factors, spontaneous collapse, trauma, malignancy, infection or a complication of mechanical ventilator. Rational होगा understanding the cause of lung collapse and necessary for proper chest tube placement and choice of other therapeutic measures. Second, check out respiratory functions. Here respiratory distress and changes vital sign. Next, auscultate breath sound. Atelectasis area will have no breath sound and partially collapsed area have decreased sound. Number 4, assist patient with the splinting painful area when coughing. Deep breathing air supporting chest and abdominal muscle make coughing more effective and less traumatic. Next, maintain a position of comfort, usually with the head of bed elevated. Turn to the affected side. Encourage patient to sit up much as possible. Rishnoga promote maximal inspiration, enhance lung expansion and ventilation in the unaffected side. Next, monitor oxygenation status here. A worsening in hypoxemia may indicate the need for increased oxygen support such as intubation. Next number intervention देखते हैं. If a significant amount of blood, that is 1500 ml, is found in the pleural space, hemothorax thoracotomy may be recommended. Here, rational होगा. A thoracotomy surgically opens the chest wall and can more effectively drain large amount of air and blood from the pleural space. Next, prepare for chest tube placement here. A chest tube will evacuate the air or fluid allowing the lung to reinflate. After providing these interventions, we rated the evaluation steps. Now here evaluation is now improve breathing patterns here. गोल हमारा टू मेंटेन इफेक्टिव ब्रीदिंग पैटर्न हमने अचीव किया थ्रू दीज इंटरवेंशंस. नेक्स्ट देखते हैं केयर प्लान नंबर 3. थर्ड केयर प्लान होगा रिस्क फॉर इंजरी. यहाँ पर नर्सिंग असेसमेंट में सब्जेक्टिव डाटा नॉट एप्लीकेबल बिकॉज दिस इज द रिस्क diagnosis and objective data. Here the patient is restlessness, anxious, hypoxemic on ABG chest X-ray. Diagnosis होगा risk for trauma. Risk factor may include concurrent disease and dependence on external devices, chest drainage system. Goal होगा to reduce risk for trauma. Nursing interventions rational. First, explain with the patient purpose and function of the chest drainage unit, taking note of safety features. Rational होगा information or how the system work provide reassurance, reducing patient's anxiety. Next, advise patient to avoid lying and pulling on the tubing. Here, reduce the risk of obstructing drainage and advantageously disconnecting tube. Here, third, identify changes or situation that should be reported to caregivers, such as change in the sound of bubbling, sudden air hunger, and chest pain. Disconnection of the equipment. Rational timely interventions may prevent serious complications. For intervention, anchor thoracic catheter to chest wall and provide an extra length of tubing before turning or moving patient. Here, rational prevents thoracic catheter dislodgement or tubing disconnections and reduces pain and discomfort associated with pulling or jarring of tube. Next, secure tubing connections site. Here, prevent tubing disconnections. Next, perform a fall risk evaluation and enact the proper safety interventions. Here, rational the fact that the patient is attached to a chest tube unit in addition to being restlessness, anxious, and hypoxemic means she is high risk for fall. Exchange the chest tube dressing daily as needed, monitoring the site for sign and symptoms of infection. Here, aseptic techniques for dressing is important for the infection prevention. Redness rather than drainage can indicate an infection. Next, palpate the chest and neck for crepitus, subcutaneous emphysema is in complications of chest tube and indicate an air leak into the subcutaneous tissue which can be life-threatening. Next, monitor the chest tube unit for any bubbling openings in the tubing. Here, bubbling indicate air leak and kinking or clamping can cause a tension. Pneumothorax do not clamp without a physician's order. Next, tape all connections of the chest tube and maintain the prescribed level of suction. Here, it's important to maintain a closed system free from leak. Suction can vary minus 10 to minus 20 mm of and rarely exceed minus 20 to 25 mm of. Next, observe for sign of respiratory distress if the thoracic catheter is disconnected or dislodged. Hemothorax may recur or origin compromising respiratory functions and requiring emergency interventions. After providing these interventions, we write here the evaluation for this care plan, or evaluation is risk for trauma reduced. नेक्स्ट देखते हैं केयर प्लान नंबर 4। केयर प्लान 4 होगा रिस्क फॉर इन्फेक्शन। यहाँ पर नर्सिंग असेसमेंट में सब्जेक्टिव डेटा नॉट एप्लीकेबल बिकॉज दिस इज द रिस्क डायग्नोसिस एंड ऑब्जेक्टिव डेटा वाइटल साइन assess the sign of infection, assess the CBC readings here diagnosis होगा। this is diagnosis। risk for infection may be related to invasive process, traumatized tissue, skin, broken skin। goal होगा to reduce risk for infection। intervention rational देखते हैं। first promote for good hand washing staff and visitors, screen and limit visitors who may have infections, place in reverse isolation as indicated here rational होगा। protects patient from source of infection such as visitors and staff who may have an upper respiratory infection। Next, monitor vital sign and sign of infection and provide baseline information to interventions। Next, keep patient in isolation. Here, isolation reduces risk for infection। Next, inspect site of invasive device noting sign of infections। Here, early recognition of the sign of infection। Next, administer antibiotics as indicated here may be used to treat identified infection or given prophylactically in immunocompromised patient। After providing these interventions, we write here the evaluation for this care plan। here evaluation is risk for infection reduce। जो गोल था हमारा to reduce infection उसको हमने अचीव किया है थ्रू दीज इंटरवेंशंस और यहाँ हमने evaluation लिखा है। नेक्स्ट देखते हैं 5th केयर प्लान। 5th केयर प्लान होगा डेफिशिएंट नॉलेज। इसमें देखते हैं यहाँ पर subjective data patient is asking question about hemothorax and objective data looking anxious and irritable। diagnosis होगा deficient knowledge may be related to lack of exposure to the information। goal होगा to improve level of knowledge। next यहाँ लिखेंगे हम intervention and rational। first intervention review pathology of the individual problem। here rational होगा information reduces the fear of unknown। here second determine the likelihood for recurrence and long-term complications। rational होगा certain underlying lung disease such as severe COPD and malignancies may increase the incidence of the recurrence। next third reassess sign and symptom of hemothorax। here recurrence of hemothorax required medical interventions to prevent or reduce potential complications। next review the significance of good health practices, adequate nutrition, rest and exercises। here maintenance of the general well-being promote healing and may prevent or limit recurrence। after providing these interventions, we write here the evaluation steps। now here evaluation होगा now improved knowledge level मीन्स जो हमारा गोल था टू इम्प्रूव लेवल ऑफ नॉलेज वो हमने अचीव किया है थ्रू दीज इंटरवेंशंस और यहाँ पर हमने evaluation लिखा है now improved knowledge level। तो फ्रेंड्स ये था हीमोथोरैक्स का नर्सिंग केयर प्लान। तो फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपनी लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद योर फ्रेंड एंड subscribe my YouTube channel here Anna Nursing File Preparation for the Nursing Competition Examination and press bell icon also। Thank you।